Thanks for joining us today on Retirement Talk. And today we're going to talk about one of the most important topics and maybe one of the most confusing topics that retirees or people getting ready to retire have to make decisions on, and that is regarding Medicare. Today we're going to talk about when do we need to sign up for Medicare, how much does Medicare cost, what are some of the negative items we need to know about as it relates to Medicare. And so today I'm excited to have with us our in-house resident healthcare specialist and financial advisor, Frankie Merritt, to help us answer some of these very complex and confusing questions and to make them very simple for those that have decisions to make regarding Medicare coming up. To begin here, Frankie, we're going to start with the most basic part of Medicare, which is, when do I need to sign up for my Medicare benefits?
Yeah, well, thanks, Dan. As you know, October 15th starts the annual election period for Medicare, and there's a lot to know. So Medicare is a big decision, and it's important to understand the ins and outs of making the best choice. And so when you need to sign up for Medicare, when you're first eligible at 65, you get a one-time in, and then it's called your initial election period. So it starts 3 months before your birthday month, the month of, and 3 months after. So you really get 7 months to sign up for your initial Medicare. So that's kind of where we stand at this point.
Okay, so they give you some months before, month of, months after.
Yep.
So that's kind of when we turn 65. And I think that's when a lot of people really get bombarded with these infomercials, things in the mail. And so, but we find a lot of people are working past or maybe are still working at the age of 65. So if I'm still working and I'm 65 years old and I'm covered by an employer's health insurance plan, or maybe I'm covered by my spouse's health insurance plan from their employment, do I still need to sign up for Medicare if I'm still covered by other insurance at the age of 65?
Yeah, so that is a really great question. So if you're still employed by your own employer or your spouse's employer, you do not have to sign up for Medicare's Part A or Part B. As long as they're credible coverage and you get notice of that every single year, you will not have any penalties associated with that. So just at least a couple months before you go to retire, you got to file for Parts A and Part B. And then there's a little caveat about HSA. If you're going to participate in a health savings account, you can't do that and also have Medicare Parts A or B. So there's a lot of little things to know about that. And so you just contact us and kind of walk you through that.
Yeah, I think that's a big one. Not being eligible to contribute to the HSA if you sign up for Medicare, even the free one, can cause you to be ineligible for those triple tax-free benefits that are given by the HSA, which is great. So just because you turn 65, you don't necessarily want to go ahead and turn on Medicare. You know, we find people that, well, I'm just going to go ahead and do it so it's behind me so I don't forget, but there can be some negative consequences actually to turning on Medicare at age 65. Just real quick to go back to one thing, Frankie, you said, so let's say that I'm 67 years old and I'm going to retire in a few months. I've not turned on or signed up for Medicare. You said you need to sign up a couple months before, or can I sign up for Medicare after I retire and not be penalized, or like kind of give a little more around that specifically? Because that's a big question we get here at our office.
Yeah, so Social Security has 60 days to process your Medicare enrollment. And so you don't want to have a lapse in coverage. And so you want to make sure you get that done in time, get your 11-digit ID number, because that's what we really need to process your enrollment. And what happens is if you don't, then it doesn't verify with Medicare, and then everything has to kind of start all over again. So that's very important that you get that done in a timely manner so there's no lapse in coverage.
Okay, so we do need to sign up before you actually do retire to make sure we have all that. Okay. So let's talk about what happens if I don't sign up for Medicare at the age of 65. And again, this is with that caveat of and I don't have other health insurance that will cover me. So assuming I'm retired, I hit 65, what happens if I don't sign up for Medicare?
There'll be a 10% penalty for the rest of your life based on for every full 12-month period that you didn't have credible coverage.
Oh, so don't do it.
So don't do it.
So make sure you sign up in advance. I think that's a big one. Man, this is maybe one of my favorite things to talk about when it comes to Medicare. I'm constantly bringing this up in client meetings because so many people have no idea what we're going to talk about, and that's IRMAA. Okay, IRMAA is income-related monthly adjustment amount, and so what a lot of folks don't realize is that there are some base costs when it comes to Medicare, but if your income is at certain levels, and say you bring in a certain amount of income that's higher than others, you can actually pay more for the same health insurance benefits that somebody else is getting, but because of your income, you get to pay a little bit more. It almost feels a little bit like this part of Medicare is a means-tested part of the government system, and they say we have no means testing in our government, but this one really feels like that. And so explain what IRMAA is and how it can potentially impact some of these Medicare costs.
Yeah, so IRMAA is an additional charge into your base premium, and then the more money you make, and it's also if you are single or married filing jointly, there are different thresholds that you meet, and there are several different categories that you would go into. And when you file for Medicare, they're going to look at your income from 2 years prior. So whatever you were making then is going to kind of determine what your Medicare premiums are going to be. But there's also different things that you can do to change that as you go forward and you're reducing your hours and your income. But basically, it's the higher you earn in your wages, the more you're going to pay for your Medicare benefits, both on the Part B side and the Part D side.
So the Part B right now is around $174, I think, right?
$174.70.
$174.70 is the base, and it can go up as high as like up in the 700s. Or what's the highest?
It could add about another $560 some a month.
In addition, over and above the 174. So there's people out there that could be paying $500 plus more per month per person if you're married, right? Think about that. So if you're a married couple and you get into some of these higher brackets, that could be an additional over $12,000 per year that you get to pay for the Medicare benefits that somebody else is paying significantly less for. So understanding IRMAA may be one of the most important facets as you prepare for retirement, and then even if you get into retirement. What's interesting is when people do retire, Frankie, usually they're at like the highest earning that they've ever been at, right? When people retire, one of the hardest things for people to do when they retire is to walk away from work because they're making the most money that they've really ever made in their entire life. For most people, for a lot of folks. So a lot of people are in what would be considered one of these IRMAA brackets going into Medicare. So Medicare is going to look back 2 years, see their income was way up here.
Right.
And even though in retirement their income might be considerably less, which for most people it is going to be considerably less, are there things they can do to get an adjustment down to a more reasonable level based on what their future income might be?
Yeah, there's a waiver request that can be filled out and you send in with your taxes and based on a bunch of different circumstances of how your new income is going to be reflected. And if it's much lower, we send that into the Social Security office and then they review that and then you get a determination letter that tell you if it's been reduced or not.
And a lot of times that's important because not to confuse things, but when someone signs up for Medicare the first time, they hold that premium for 2 years, is that correct? Or is it adjustable every year when you turn 65?
It's adjustable every year when you turn 65. You just have to prove in the documents of what your income is going to be, and they'll go through because they're going to get the tax records going forward every year.
So if you do find yourself in one of these IRMAA brackets, it is changeable. It's not like we're stuck there forever. But there is a way for you to even get that adjusted down, especially if you're going to retire. What's interesting about IRMAA is what types of things they count against you, right? It's not just earnings from employment. Break down real quick, what all do they count against you when they factor in this IRMAA?
So they're going to count all interest income. They're going to count any withdrawals from RMDs. You do Roth conversions. You sell a business. All of that investment income gets added to your modified adjusted gross income. And so anything that number comes out to be is what's going to be determining what your Medicare premiums are going to be.
So basically everything.
Everything.
Dividends, interest, capital gains, you sell a rental property, you sell some stock, you take an IRA withdrawal. They even count against you tax-free municipal bond interest, right? I mean, if you have tax-free municipal bond interest, it's tax-free, so I'm not paying taxes on it. However, that still does count against your Medicare IRMAA. The only thing, I believe there is one thing that doesn't count against Medicare IRMAA, and that would be what?
VA disability benefit.
VA disability benefits. So essentially, this is one we really need to pay attention to. If you wait until retirement and to figure out what IRMAA is, there's a good chance that you're going to be penalized and paying more for Medicare, or even in your retirement years. Certain decisions that you make could have significant negative consequences against you. So you're just out there enjoying retirement, spending some of the money that you've worked hard for, and then all of a sudden 2 years later you get a letter in the mail that you get to pay more for your Medicare, and you didn't even know it. So those are not pleasant letters to get. You can avoid them, or at least prepare yourself for them well in advance. All right, so when getting to the point where I need to decide which Medicare plan to choose, I think this is where it gets really confusing for people. They're getting hundreds of letters in the mail of all these different types. How do I know which Medicare plan is best for me?
Well, you really have to choose between, there's just two options. There's original Medicare, and then you can pick up a Medigap or a Medicare supplement, and then a prescription drug plan. Or the other option is Part C, which is called the Medicare Advantage prescription drug plan. And so between those two, it's just going to depending on what your most out-of-pocket expense you think you can handle, and different types if you want to continue to use a specific network that you were used to using before. And then premiums, of course, there's always that, what's going to cost you now and what's going to cost you in the future.
Yeah, so as it relates to cost, if you're going to go with a supplement type plan as opposed to a Medicare Advantage, what could be the difference in costs for those, just a range?
Yeah, so it probably costs about $150 roughly a month beginning at age 65 that you would pay more for a Medicare supplement and a prescription drug program than you would for a Medicare Advantage. But you just got to remember on the Medicare Advantage side, you're going to have copays when you go see a physician, and you don't have that with the original Medicare and a supplement.
So with an Advantage plan is free, but you pay every time.
No premium.
There's no premium, but every time I see a doctor, every time there's going to be something I pay out of pocket.
Yes.
And then with a Medicare supplement plan, I pay monthly, but do I also pay when I go see doctors?
No, but you will have a deductible, and right now for 2024 it's $240. So that's an annual deductible.
So if I pay my monthly, then pay in $224, I think you said, then I don't pay anything else for any other doctor visits.
Correct. As long as Medicare approves the charges, then you wouldn't pay anything else.
Okay. I think that's a big one. And I'll say this, cost matters, but the one area that you might not want to try to cut corners on, in my opinion, doing this for over 17 years, working with retirees and people that get older every year, the one area that you probably don't want to cut corners on is health insurance, right? Cut corners on a lot of things, cable, where you go buy your food, buy your gas, etc. But man, do not cut corners on health insurance, because it can absolutely come back to bite you. And just like anything else in life, Advantage plans, to me, they're not bad. I wouldn't say, like, a lot of times we recommend them, but sometimes free has a cost. So just know that in advance, that just because it's free doesn't mean it's free. I think we all realize that. So know what those costs could be. A big one, when people retire, one of the things a lot of folks enjoy doing is travel. So are there things I need to know about my insurance plan as it relates to traveling either domestically or internationally?
Yeah, so when it comes to traveling, if you choose original Medicare, they don't cover any travel outside the United States. So if you buy a Medigap Medicare supplement, you'll have a $50,000 lifetime reserve that you can use. But then on a Medicare Advantage, you do get some worldwide services, and it's limited as well. So if you're traveling outside the United States, I would recommend that you always purchase the travel insurance, just because it's very expensive to get flown back here to the United States if you've got something that's catastrophically happened.
It may not be able to, right? I mean, if it's serious enough, they may have to just act there immediately.
Yep.
So I think that's a big one. The travel insurance is huge as you get older. I think that's great advice, Frankie. So just unpacking here, one other item. What about my doctors? So, a lot of folks have doctors, have networks that they've been with for many, many years, and then all of a sudden they have to go on to Medicare. Our doctors, my doctors, the ones I'm using, and if you're using them, you want to keep them, are they all going to be covered under Medicare?
So that's a good question. And so with a Medicare Advantage plan, there are networks. And so there are several major players out there, and some could be in, some could not be in. If you want to make sure that your doctor is in network, you have to go specifically to that provider's website and check it out there. But if you take original Medicare and a supplement, as long as the provider or facility takes original Medicare, they'll take your Medigap or Medicare supplement because it's a balance bill. As long as Medicare pays first, your supplement will pick up the balance after your deductible. So there's not much to that. And at Medicare.gov, you can check to see if that provider takes original Medicare. So that's a helpful site as well.
Mm-hmm. Okay. And then real quick, one other item we want to talk about is you've kind of mentioned these, but just a brief breakdown. What are the different types or different parts of Medicare? You've referenced them, but kind of give us the breakdown.
Yeah, so Part A is your hospitalization, your skilled nursing, and hospice care. So that covers most of those facilities. Part B is your medical insurance. It's going to cover your doctors and your procedures, outpatient, some medical supplies, and preventive services. Part C is your Part A and your Part B, and then Part D, which is prescription drugs, all rolled into one plan.
So Part A, the cost is?
It is zero. You paid
free.
Well, it's not free. It's a zero premium because you paid in Social Security tax, and so that's kind of where you get the zero premium based on Part A. But you got to have enough credits to get that for free.
Okay.
Or to reduce premium.
And then Part B, we talked about.
Yeah, so that is your $174.70, as it says, for 2024 to pay for all your medical costs as far as doctors, outpatient care, that type of thing.
Unless we find ourselves in an IRMAA bracket, and Part B is the one that's impacted that can go way, way up.
Correct. Yes.
So 174, that's the base, could be more.
Yep.
Part C, the cost, that's the Medicare Advantage.
Most have a zero premium. Yep.
Zero premium, but co-pays.
Yes,
at the doctor. And then Part D, there's a cost for that as well.
Yeah, so that's with a private insurance company to take care of prescription drugs, and then it would have an IRMAA impact as well based on your income.
Okay. So to kind of round this out, Frankie works with all of our clients here that have Medicare questions. Frankie, you don't work for just one company, right? I mean, you are an individual that can offer how many different plans in the state of Tennessee? Some, all?
We mostly work with the A-rated companies that are here in the state of Tennessee. And so we don't represent all of them, but we have a majority of them that we work with.
Yeah, one of the most, I think that's important, to be able to shop around, have one person to be able to shop around different costs for you rather than going to 15 different companies, 15 different individuals, trying to take notes on all that. I've seen it in the office. There's a software that Frankie has that basically pulls up all these different plans, the different costs involved. He can back shop doctors to make sure that if we only want certain doctors, just plug that in. So only the plans that would cover that become available. So we can almost start narrowing down the search based on all of the criteria that you have, rather than kind of starting outward and coming into what you want. You can really start with the inside of what you're looking for and search that to make sure that only those items are pulling up. I mean, I think that's one of the benefits of working with a firm like Beacon, and that has somebody like Frankie on staff, so that we're going to be able to talk about what kind of income are they going to have in retirement, so that we can look at IRMAA if that's going to impact them. Are there ways to reduce that? So as you can see, there are a lot of moving parts as it relates to Medicare, and I strongly urge you to talk to somebody who's a specialist and that can represent multiple companies. Probably more importantly, I also think you should be working with a financial planning firm that incorporates Medicare into your financial plan, so that your financial advisor and your health insurance Medicare specialist, that they're all working together. There's a ton of value being provided each and every day in our office because of the way that we have that set up. If you'd like to meet or talk with Frankie about any Medicare questions or your Medicare options, if you need help planning for Medicare coming up, you can give us a call. We'll give you a free consultation, 615-488-3039. Thanks for watching today. Don't forget to like and subscribe for more valuable insights regarding retirement planning just like this.